Hi, my name is Naima Lawson, and today I will be administering a Foley catheter on a male patient. The date is October 31st, and the time is 4:05. I've already gotten all of my supplies, my bath blanket, my Foley catheter kit, the swabs, and extra gloves, and my hand care. Before I go to the patient's room, I've also washed my hands. I'm going to pull back my curtain, and I'm going to introduce myself to my patient. Hi, today I'm going to be your student nurse, and I will be administering a Foley catheter. Can you please state your name and date of birth? Okay, thank you. Have you ever had a Foley catheter before? He states no. When was the last time you voided? Do you remember? He states yesterday. And what was the color or the odor? And he says he does not know. Now I'm going to start setting up my procedure. So I'm going to pull this back. And I'm going to get my bath blanket just to give him a little extra privacy. And then I'm also going to position my patient. Now that my patient is in the correct position, I'm going to assess that my patient's private areas are clean. If not, I would clean them. Next, I'm going to start washing my hands. And then I'm going to get my Foley catheter kit. I'm going to keep this bag because this will be my garbage bag. And I'm going to make sure that my patient knows that this is at the end of the bed. And this is all sterile, so I can only touch around the outside of it. And I'm going to bend back my paper that way I can keep my sterile field. I know that these gloves are probably going to be too small, so I'm just going to place those over there because they are still sterile. Then I'm going to pick up the waterproof sheet, and with the shiny side down, I'm going to take it and I'm going to place it underneath the patient. Just like that. Now I have an extra space for my sterile field. Next, I'm going to take the ends of this one and I'm going to place this around my patient's penis. Just like this. Next, I'm going to put on my sterile gloves. Now that I've placed my waterproof drape underneath my patient, I'm going to walk over here without turning my back to my sterile field, and I'm going to open my sterile gloves. Opening them the side farthest away from me, and folding it back to make sure there's no flat back. Starting with my dominant hand first. I'm going to pick up the cuff, slide my finger in, taking 2 fingers, leaving my thumb out, sliding this hand in, and then adjusting it once I get the gloves and I'm going to hold my hands above my waist. I'm going to walk over here, and I'm going to get the second drape that goes around the penis. And place it like so. And next I'm going to clean my patient. Now that I've placed my drape, I have my simulated swab sticks. I'm going to open these up, and I'm going to pick this top part up so that I can place my swabs in the middle. I'm going to now open my lubricant. I'm going to squeeze all of it out. Throw that away. Now that my lubricant and my swab sticks are out, I'm going to test my Foley. And before, I'm going to just take this paper off. That way it'll be easier for me, making sure I keep my Foley in the sterile field. And then I'm going to test it. I'm going to note that in my syringe there was 10 millimeters. So I want to make sure that when I'm taking it out, that's how much is going to be returning. The balloon is inflating. That's good. Okay. And then I'm just going to let gravity pull it back. I'm going to set that back into my sterile kit. Now I can go to my cleaning process. Now that I know that my Foley catheter works, my non-dominant hand is going to be non-sterile, so I need to make sure that I know that everything is set up before I start this procedure. I'm going to hold the shaft of the penis, taking my dominant hand, a swab stick. I'm going to start from the inside and then go out with each swab stick. Now what I'm going to do is now that my patient is clean, I know that my non-dominant hand is still dirty. So I'm going to take my syringe, I'm going to hook it up with my dominant hand. And then I'm going to get my catheter ready by lubricating the tip very well. Next, I'm going to take, So now that my tip of the Foley catheter is lubricated, I'm going to carefully take my catheter and I'm going to insert it into my patient 7 to 9 inches, or until I feel resistance. I'm just going to walk my fingers up now that the catheter is about 7 to 9 inches, I'm going to, since this part is not going in back into the patient, I can hold it here, and then I'm going to insert the 10 milliliters of solution. Okay, so now that all my solution is inside the balloon, I'm going to disconnect this and I'm going to pull until I feel resistance. Okay, great. Next, I'm going to hang my bag to the side of the bed. Okay, so now that my sterile procedure is over, I can take my gloves off. And usually you're going to put tape on the patient's leg, but for this video purpose, we're not going to. At this time, I would document how many milliliters I put into the patient, which was 10 milliliters, the date and time of the Foley, and I would also tape that to his leg, but for this video purpose, I will not. Now we're going to remove the catheter. Okay, so now we're going to remove the Foley catheter. I have the syringe I'm going to use in my hands. I have all of my materials, and I've already closed the room for privacy. I'm going to tell my patient again that what the procedure is going to be, and I'm going to be your student nurse. Can you please verify your name and date of birth? Okay, thank you. Right now we're going to remove your catheter. I'm going to come over. This is a clean procedure, not sterile, so I'm going to get clean gloves after I wash my hands. Gloves. And next I'm going to get my syringe. I'm going to hook it to the tube. And gravity's going to just pull out all the solution. I'm going to make sure that as much solution that went in came out, and I remember that it's 10 milliliters. And that's 10 milliliters. I'm going to take this off, and I'm going to tell my patient to exhale. 1, 2, 3. Pull it out, wrap it in my glove, and throw it away. Thank you.